Hi, my name's Ashlyn Johnson, and I did my project on readmissions and Nurse Navigator. I have actually been working throughout the year on a project that this involves. So it's kind of been nice to gather and finalize some data and processes and put them together. A hospital readmission is when a patient is discharged from the hospital and they are back in the hospital within that 30-day time frame of either a new diagnosis or an issue from the previous diagnosis. And then a nurse navigator is a role that can be established within the healthcare system. It's a person who could follow up with the patient, work on discharge planning, educating the patient on maybe what their illness is and how they could routinely maintain that at home. So, anytime a patient comes back into the hospital for a readmission, costs definitely are always an area that are looked at. Costs with medicines go up. The patient's either going to need more costs, they're going to need more scans, testing done. Physicians are just trying to find out what's wrong, why they're brought back into the hospital. You're going to have lower reimbursement rates due to basically the patient being back so soon, but also due to maybe repeat of care versus insurance looking at maybe what they were treated for before they left, coverage not being guaranteed because of that issue. So there's a lot of factors that play in on both the healthcare system side and the patient side that sometimes people do not realize. So, a quote I found when I was doing my research I thought was appropriate for this was patients discharged from the hospital need support from and teamwork among hospitalists, primary care physicians, nurse practitioners, visiting nurses, pharmacists, and others. I felt that this fit the nurse navigator role well because there are so many clinical and in some cases non-clinical staff that go into a patient's care when they're in the healthcare system that having this nurse navigator role will help in all of those areas. It will not just be for one select purpose. It will basically incorporate all of the clinical and non-clinical aspects of a patient's care all in one. So within healthcare, supply and demand graphs can be in a lot of variation depending on patient care, patient cost, equipment, budgeting, but it's all within finding a balance. The more care that you need, the more physicians that are needed to take care of patients. So when it comes to supply and demand, it's finding that equal, finding that medium to basically allow for better outcomes while maintaining education for your physicians and your clinical team. So with this side, just simply using the definitions that were provided with a cost-effective analysis, the form of analysis that compares relative costs and the outcomes, basically looking at that nurse navigator role, looking at the costs that go into establishing that role, but looking at the outcomes that we will get with patient satisfaction by having that. And looking at the clinical utility as far as referring or comparing, different tools that will be needed within that role, you have to look at long-term effects. Yes, it's going to be a lot to put together for that nurse navigator role, and some people may say, that's a lot to put on one person, but every healthcare system could benefit from this so much because it's just a process put together, and following that process will allow both outcomes to grow. So, the primary goal is to have patient satisfaction and successful education. With the nurse navigator allowing patients to learn more about their diagnosis, learn more about maintaining thereafter they leave the healthcare system, but also adapting that plan of care aspect with the patient and the clinical staff. That's really how this evaluation of medical care needs to go, and really what will help set up the patient for success as well as the clinical staff to not have that repeat readmission. So, two examples I wanted to share is one patient who may have COPD diagnosis, another patient may have CHF diagnosis. So, these are similar symptoms, but they're totally different ways when it comes to treatment. Allowing the nurse navigator to focus in on these types of care, even though they are different diagnoses, they're still they're still similar in a way. But it allows the nurse navigator to really focus in on that individual and say, okay, our patient with COPD, here's the education I'm going to provide you. Here's the follow-ups. Here's how you need to maintain this when you get home. But then on the other side, here's our patient with CHF. Here's your education. Here's how you need to maintain it. So really classifying these individual diagnoses with routine care follow-ups, helping them understand what it is they have and how they need to coordinate their care once they leave the hospital. So earlier in the year, I did some research with this health system and really focusing on how to classify readmissions, but also different models different health systems use for their readmission processes. And kind of four key areas that were looked at was the care process redesign, implementation of analytics and predictive models, kind of looking at that back data, measurement, education and awareness, looking around at your community. What can you do education on? What can you make awareness of for particular diagnoses surrounding your community? So, of course, regulations, laws, all of that's always changing, being looked at. Of course, CMS, they can actually penalize the healthcare organizations if they have too high of readmission rates among specific diagnoses, kind of regarding to Medicare and Medicaid patients. One in particular, such as COPD, kind of what I had my example on earlier. So, when those hospitals have too many people coming back to them for those readmissions, that is looked at and that is calculated, and that is what then determines certain scores and reimbursement rates that they will get. So, having the nurse navigator follow and help these patients, giving them guidelines, educational materials when they're being discharged, we will have some people that will not follow those guidelines and they will end up back in the hospital. But if we can at least eliminate the majority of those readmission rates, we can put processes in order in line for these patients. Let's say that we have five people and four out of the five continue on, and we get one out of that group of five that come back into the hospital. That is a good outcome. Those are good outcomes. Because that one person, then maybe we can take our efforts with that one person, help them, and use the time that we are saving from those four other people that did continue on. They did utilize our nurse navigator process, and we can help that patient so that the next time they know how to help themselves and what they should be doing for proper care. So, when doing my research, I found some facts that I thought stood out. In the fiscal year 2013, 8% of the hospitals penalized were hit with a maximum 1% penalty. CMS estimated the total of all penalties to be $290 million. And then in 2014, 0.6% of hospitals were penalized the maximum, but with the maximum penalty doubling to 2%, total penalties were still $227 million. And then in 2015, 1.2% of hospitals received the maximum penalty, but with the rate at 3%, CMS estimated the total penalties at $428 million. So reducing readmissions contributes significantly to lowering the overall cost of healthcare in the U.S. hospital system. So within the healthcare system, there's many different tools, processes, methods that can be used, especially when looking at this nurse navigator role. There's many tools that can be used for a risk process. One risk process that I actually kind of looked at, it's like a four-step process. You would begin, identifying patients at risk. You look more disease specific, look at the protocol disease specific to the health system that you are in, performance, and then collaborate with the clinical team. Moving forward, the nurse navigator follows then a five-step process. The patient discharged with proper medical routine to follow up, no readmission reoccurrence needed. This looks at high reimbursement for the hospital. And then at the very end, your risk assessment is complete. You have better outcomes, your patient has better outcomes, and as a whole, your reimbursement rates have a potential for a larger growth. So while looking at all the processes when adding the nurse navigator role for growth, success, better outcomes, you then look at the other side without a nurse navigator. Your efficiency goes down. You have longer wait times in your ED because you have more patients to care for. You have lower reimbursement rates. You have a negative patient outcomes because patients are not going to be happy when they're having to sit in the wait rooms, when they're not getting quick and fast care. Patient and clinician stress. This is a huge thing that's overlooked in the healthcare system. You have patients, yes, who have stress, but also your clinical staff. They're tired. They are looking for processes to allow an easier and a faster and a better day. And when they are going through these readmissions coming back in, back and forth, it's putting stress on your clinical team. So cost proposed, of course, with the healthcare system, all costs are going to be different depending on what your healthcare system is, where it's at, and how many patients or within the community what you serve, what your population is. But the main cost would be your nurse navigator role. Of course, this could be reworked within another position maybe you already have in the hospital, and just reassessing positions. Maybe you could rework a few things, maybe find some patterns that could be altered. But educational material and then an internal risk assessment. Some places already have risk assessments, so maybe just kind of critiquing that a little bit for more of a patternized follow up for those patients. So readmission payment methods, this was found for the year 2013 to 2018. CMS measures hospital performance by using ratios and kind of predicted to expected readmissions for a given measurement. They actually have a formula that is kind of pre-created that then they can put in the data, and then that's what gives them the outcome for these rates. So this is what they call the payment adjustment factor formula. This is what is used to calculate the payment reduction processes for the healthcare systems. So basically, you've got your savings, you've got your processes, your delivery of process. Basically, the nurse navigator is able to educate patients on current diagnosis, handle medications needed, set follow up appointments, and transportation needs for continued care. Sometimes, kind of like those medicine follow ups, your transportation is always something that's forgotten. Maybe patients need transportation to get their medicine. Maybe patients need transportation set up to be able to get to their follow up appointment. These are those processes that having the nurse navigator, she's able to speak with the patient, with the families, and see where those issues are and really kind of get those ironed out before they leave. This, again, is what will lead to higher and better outcomes. So, in conclusion, establishing this role will not only help with patient satisfaction and better outcomes, but justify why local and surrounding areas should seek help from your healthcare system. So, if you have a nurse navigator and her primary goal is to not catch all the patients coming into the healthcare system, It's to catch the readmission patients coming into the hospital, looking at her risk assessment, following her tools, following his or her guidelines on how to adequately assess, does this person need my help? What can we do to give them education? How can we help them maintain their care after they leave the hospital? They themselves will have a process that they follow, they look at, and they classify who falls in those categories to try to help so that they do not end up back in the healthcare system. And overall, this is going to establish higher reimbursement rates, better satisfaction when it comes to clinical and patient scores, and overall better outcomes for your community. Through my research, all of my references are listed on this slide. So earlier in the year, I had a class that we actually did a little bit of research on Nurse Navigator and readmissions, and we took content and I actually created a poster with it for another purpose. And it was actually the example that was used within this project. But I took that format and then just added in some of my new content that I have found with my newest research for the Nurse Navigator role. So this is what you see here. I've got a little bit of content in here that maybe was from our previous poster. Most of it is going to be new content. Of course, the formula calculator is on here. My references are listed. Um, and then over to the left, the patient navigator relationships. I really like this. It shows the healthcare team, it shows the patients, and then it shows the community providers that all come together with the patient navigator. Those are all the touches that that nurse navigator role will make for better outcomes for the patients.